trials to show the cleaning efficacy of Medstar technology, particularly in relation to multi-level cleaning. Please be advised that for the purposes of this trial, the basket tier system has been removed to enable validation between the 3 tiers. The system was set to validation mode to enable preliminary cavitation readings to take place. Once full, the lid automatically opens. With no instruments or chemical in the tank, cavitation readings were taken. Next, 1x alpha type B super dim basket loaded with instruments was placed into the tank. The tank was then refilled as previously. Cavitation readings were then taken directly above the tray of instruments. A second tray of instruments was then placed in the tank directly above the first basket. And cavitation readings taken above the second basket. A third tray of instruments was then added directly above the second basket. And cavitation readings were then taken above this basket. All baskets were then removed and brown soil liberally applied. All trays were then left to stand as per the manufacturer's instructions. To further gauge the efficacy of cleaning, 2 different process challenge devices were introduced on each level. Firstly, Aseptium Veritest frames were placed in each corner and in the centre of each basket, making 15 frames in total. Secondly, this was repeated with the less robust Sonocheck vials, again 1 in each corner and in the centre. We decided to do this to show the viewer that no matter what challenge method was used, the results would be shown across the 3 levels. The cleaning cycle was then started. The standard cleaning cycle in a Medstar 3 is 2 times 15 minutes in cold water. There is also a longer cycle for the cleaning of robotic instruments and lumens. The chemistry used was PDA 51 from Circhem. At the end of the cycle, the instruments were removed and visually inspected. The Sonocheck vials were removed, and as it can be seen, all 15 had turned colour to yellow, indicating a pass. The Veritest frames were also removed and visually inspected. All the test strips were visually clean from sheep brain homogenate. 3 random instruments were then taken from each level and measured for residual protein using a ProReveal device set to the nanogram range. All instruments were shown to have a residual protein level of 0 nanogram, except for one instrument that showed a residual level of 496 nanograms, or 0.496 micrograms. Finally, all 60 test pieces from the Veritest frames were also tested for residual protein in the ProReveal. All 60 slides showed a total of 0 nanogram. What this trial demonstrates is the very high cleaning efficacy of Medstar technology, even when multi-level cleaning is required. It should also be noted that with residual protein at this level, the removal of bacteria is made easier. Independent trials have shown that log reductions of between 5.5 and 6.6 are achieved in cold water. Medstar technology is available in several tank sizes from 400mm long through to 1100mm long, as well as in Medstar 3, as used in these trials. Medstar, cleaning on another level.